Cancer treatment can be grueling, debilitating, and seemingly never-ending. The new way of doing things at Austin's CyberKnife is aiming to change that. Dr. Paiman Ghafouri is a radiation oncologist at the center, joins us now with more. Hi, doctor. How are you?
Good, thank you.
Here today, you brought the robot. Tell me about CyberKnife, first of all, and what you do and what you have here.
Well, CyberKnife is a robotic device that's used to deliver radiation, and its innovation is that it's ultra precise, it's very accurate, and it has the ability to deliver radiation very specifically to a target and minimize the amount of radiation to normal tissues, healthy tissues, and that's really the basis for maximizing the desired treatment effect, but minimizing the potential side effects in the treatment.
Right.
And with respect to many different types of cancers that are now treated with CyberKnife, this has become an immensely useful tool in oncology and also in some benign conditions that CyberKnife is used for.
And we're talking in regard to National Prostate Health Month specifically today, and how this can be so instrumental in the treatment there, right?
Right. So CyberKnife has really revolutionized in many ways the treatment of prostate cancer. And in recent years, there's been a significant amount of data and clinical work that has been performed and now published, which has proven the safety and efficacy of using CyberKnife for the treatment of prostate cancer. The most important aspects of applying CyberKnife for prostate cancer is that it changes the way that the treatment is delivered. In traditional forms of radiation therapy, for example, which take up to 9 weeks or over 2 months of treatment.
So lengthy.
CyberKnife can deliver the treatment in about a week in 5 or 4 sessions. So it's dramatically shorter. But from the oncologist's perspective, perhaps the most important aspect of the treatment is that it has proven to be highly effective for curing the cancer, or allowing us the opportunity to cure the cancer, and is now considered to be a first-line treatment for prostate cancer. And other developments recently that have taken place is that the American Society for Radiation Oncology has recognized it as a first-line treatment for prostate cancer, and that's an important national body for radiation oncology. Additionally, there is a national, very authoritative, and probably the most robust set of guidelines in oncology called the National Comprehensive Cancer Network, NCCN, and they've also recognized it as a first-line treatment. And probably as a response to that, now many insurance providers are providing coverage for this treatment for prostate cancer. So all of that has really changed the options very much for patients with prostate cancer.
And I'm sure you've had some great experiences with patients and how they've been able to deal with this and getting through it because of this, right?
Right. I think you know, the goal in any cancer treatment is to really maximize the quality of life and also at the same time maximize the chance for cure. And that's really what we're aiming for. Whereas with traditional treatments for prostate cancer, with a number of different modalities, there were several several potential side effects that were quite significant and a relatively high risk for those, including things like urinary incontinence, impotence and sexual dysfunction, as well as other potential inflammatory side effects in the pelvis. Those are really dramatically reduced with the use of CyberKnife, and the basis for that again is that the ability to deliver the radiation to the target in a very precise and accurate manner.
We appreciate you being here today. This is fascinating, great information. Thank you, doctor, very much. And go to austincyberknife.com for more on the conditions they treat, to learn more about the physicians, and to see patient testimonials. After the break, we're talking new music and enjoying